Hello, I'm Doug Apple, back with another special interview for you today. And do you remember in early 1991 when the war began in the Persian Gulf? That's after Iraq invaded Kuwait. And you remember watching those detailed news updates with General Norman Schwarzkopf and General Colin Powell? Those guys were like heroes to the country at the time. And I think probably either one of them could have been elected president. And then you jump ahead 20 years and we had another national emergency. We had the COVID-19 pandemic, and we had a doctor who was on TV all the time giving us updates and expert wisdom and advice, and maybe he could have run for president someday. Well, now his diaries are out, and I'm pretty sure he's not on the fast track to being the president. Of course, COVID-19 and then the government's reaction to it was a hot topic every day from the very beginning, and a lot of division, a lot of, it ended up being very political, but you didn't know if you were getting all the information. And then, as often happens in these historical cases, over the years, the actual information starts to leak out. And that's what's happening in the news right now. We've got Mike Sharman, the general counsel for Share Healthcare, on the phone line with us. And we're going to talk a little bit about Dr. Fauci. And I just wanted to know what Mike Sharman had to say about these recent revelations.
Well, thank you, Doug. Thanks so much for that. And, I think we each should take a lesson from this to watch out that we don't have these Fauci-like tendencies too, because what we can see now reading his diaries is that it was pure ego. It was pure pride that pulled him down, and pure pride and his pure pride and his pure ego that created so many problems for millions of people. And there's very few of us that are going to have that sort of influence over our state, our nation, and the world. But each one of us have influence over the people that we're in contact with, our family, our workplace, our community. And we want to, keep a good close check on ourselves, that we allow ourselves to be teachable, that we allow ourselves to hear different voices, that we don't guard our pride and our ego so much that we're going to refuse to face the truth even when it's right there in front of us, or that we don't want to admit we're wrong even if it's going to wind up hurting many, many people. And we can see by, like you said, having this look now into Dr. Fauci's diaries, we're able to see that's exactly what happened. Having a little bit of backstory here. Remember, we had at the very beginning of the knowledge of COVID, the national knowledge of COVID, President Trump went on TV with Dr. Fauci and a couple other advisors, and Mike Pence right there with them. And we're telling us we need to have 15 days to shut down, 15 days to quarantine so that we don't have the spread. 15 days, and that's it.
Mm-hmm. All
right. Well, the 15 days stretched on, and President Trump was pushing Dr. Fauci to be giving the opinion that it's okay to open up, and Dr. Fauci wouldn't. Here's the interesting thing. The President of the United States had less control over it than the director of the CDCs and the medical spokesperson. Why? Because fear rules. And if Dr. Fauci was saying that you should fear all of this, that's what people listen to, not the president who wanted to open things back up. And in some of the communications that Dr. Fauci wrote in his diary, he wrote that President Trump had said, "Tony, I really like you, and you know that, but what the blankety blank are you doing?" And then he said, Fauci quoted Trump as saying, "You constantly drop bombs on me. Everybody wants me to fire you, but I'm not going to fire you. You have too illustrious a career, but you have to be positive. The country cannot stay locked down." Well, what do we know what happened? The country stayed locked down.
Mm-hmm.
And then in the diaries, it also mentioned that President Trump, that Dr. Fauci was advising President Trump to have the nation stay locked down. But then Trump said, no, I'm going to take the federalist approach and I'm going to let the governors decide. And that's what happened. Now, in Virginia, where I am, we had a Democrat governor at the time that was awful. He kept everything completely locked down and only allowed abortion clinics and liquor stores basically to stay open. And there was a church that literally had 15 people meeting, and that pastor was arrested and convicted, and it stayed up on appeal. I sued. I found 3 plaintiffs at my church. We sued the governor, and we were able to get a negotiation, a settlement where churches could open back up and up to 250 people, but you still had to do the mask and the 6-foot seating, both of which we later found out weren't really going to help anybody with COVID. But that's not what Dr. Fauci was saying at the time. He also denied that he had anything to do with the creation of this problem, that gain of function research, which is the root of the COVID-19 disease problem. He denied that he had anything to do with it, and yet he had. He had funded it. It was his idea, or much of his idea. Well, why did he deny it? Because then he would have looked bad before the world. And his ego and his pride would not let him, even though it was just a researchable fact, let's say. It was going to come out sooner or later. He also had been learning, and he writes this in his diaries, that he had been learning that his excuse for why this occurred, that it was a wet market problem, that the markets in China that had, just open air animal meats being sold, that was the problem. Well, no, it wasn't, and he knew it wasn't. And even after he wrote in his diary that he knew that was a false theory, he afterwards was still saying that's the probable cause, even though he knew that was not. Those are, the type of things that somebody might do on a lesser level of, did you have a drink on the way home from work? Oh, no, I didn't. Well, I might have had one, and the person actually had more. And within our sphere, we might know people who do that. Well, his excuses, his avoidances had vastly more consequence to that. In his own diary, he wrote, "To be fair, we should consider that there are unintended consequences in my area of health." And then he mentioned that he had spoken to the directors of the director, plural, of the Center for Disease Control, and that they estimated that more than 1 million children around the world would have missed measles vaccine due to the shutdown. Okay, so because of the shutdowns that Fauci had been promoting, that he was not only the voice for the nation, really, but the voice for the world of medical science on this, let's say, that he was saying, more than 1 million kids would miss having a measles vaccine. Well, then this is what he knew and what he wrote. He said, "This is terrible and needs to be addressed, since on that basis alone, there would be far, far more excess deaths from measles among children than coronavirus deaths among children." So he knew that because of the shutdown and because of people not coming out and doing their normal things and getting vaccinated on just the normal things, that there would be more children dying because of measles than would die from coronavirus deaths. And we know that even though he mandated vaccines for children for coronavirus, they didn't need it. In fact, they were going to be winding up having more health problems because of it. And then just recently, we had the Senate hearings, and Dr. Fauci was asked by Senator James Langford, well, did you ever have the opportunity to bring up the potential of measles deaths among children based on the fact that so many children would not get their measles vaccine because of the shutdown? So he was asked that direct question based upon what he had put in his diaries. Well, that was one of the 111 questions that he refused to answer and claimed the fifth on. And I don't know if your listeners heard this, but Senator Josh Hawley got so fed up with Dr. Fauci claiming the fifth over and over and over, that he said, okay, well, what is the color of your tie? I claim the fifth.
Yeah.
What's the color of the carpet?
You're a lawyer, okay? You're an attorney, and I guess he had some legal reason for doing it. But my thought was, and here's the thing: the people who are more left leaning will say they were just trying to trick him and trap him. And I thought, okay, well, you use the fifth so you don't incriminate yourself. All right, but now if you're using the fifth because you don't want to say what color is your tie, to me, that sounds like, that's not a trick or a trap. It's almost like a little test question, like, is this machine working? And the answer kind of was, no, the machine is not working.
Well, on that particular issue, what color is your tie? What color is the carpet? What day of the week is it? He pled the fifth on all this. That same type of thing, I had a judge give somebody 10 days in jail immediately for doing that same type of snarky avoidance.
Yeah, it's just shenanigans.
I asked substantive questions. They pled the fifth. I then asked a very similar type of question like that he obviously could have answered. And he said, I claim the fifth. And the judge said, all right, contempt of court, 10 days in jail, started today. Because that is contemptuous of the court proceeding.
It is.
All right, so that's one thing right there, that basic concept of you can't be contemptuous of the tribunal that has the ability to put you under oath. Mm-hmm. You can't. You do have to answer questions honestly, so help you God. All right, no, so that's a small thing, you being snarky about the color of your tie, etc. But the bigger thing is he couldn't incriminate himself criminally because he had a federal pardon that gave him a pardon for any and all things he did going back in time. So he could not have jeopardy at the federal level. So why would he plead the fifth? Well, one, pride and ego. He didn't want to have to admit, even though he is completely free from any federal prosecution, he didn't want to have to admit that he'd actually done these things, that he had put people in harm, that he had thought so highly of himself. He was saying about how he is now the most famous person in the world. He put that in his diary.
Yeah.
And the most recognizable face, all that. Well, but why would an attorney advise him? And he had a bank of attorneys there. Why would an attorney have advised him to plead the fifth? Well, because if he had ever come down to Florida and said something along those same lines, advised people in Florida, well, your Florida prosecutors could convict him, could try him, prosecute him for that. In Virginia, which there's a fair number of the federal offices are in Virginia. So he could have said something or done something there that would be a state crime. Mm. So we need to have a whole lot of these state prosecutors looking at what did he do in their state. Now, we don't have to worry about Fauci being free from any consequence because we know the Lord knew everything.
Right.
And the Lord cared for every one of those people that didn't need to die or didn't need to suffer or didn't need to be shut out of their businesses or didn't need to be shut out of their churches, that had those consequences as a direct result of Dr. Fauci's pride and ego, that he didn't want to admit that his analysis was not right. In those diaries, he is talking basically to himself because he's writing his diaries. And he's talking about another doctor that was in one of his institutes who was junior to him in one of his institutes. And that doctor, Dr. Mamoli, had warned him in an email that coercing or forcing people, and this is the quote from that email, coercing or forcing people to take a vaccine can have negative consequences from a biological, sociological, psychological, economical, and ethical viewpoint, and is not worth the cost, even if the vaccine were 100% effective, which that doctor didn't believe it was, and he was refusing to take the vaccine. So Dr. Fauci was very scornful of him in his diaries, and saying he's a junior member in the institute, and he's telling the institute director, which is Fauci, that I need to direct the statement based on information that he thinks is incorrect. unbelievable what I have to deal with, said Fauci with an exclamation point. Well, which one of them was right? Absolutely right on each one of those points: psychological, ethical, biological, economical. That Dr. Mamoli was right. Dr. Fauci was wrong. Well, now Dr. Mamoli has been promoted and is over quite a few things now. And Dr. Fauci is sitting in the very uncomfortable position of having to take the Fifth Amendment 111 times when he's asked things that are written in his own diaries, when he's asked about those.
How did those diaries become public?
Subpoena, congressional subpoena. So Fauci couldn't have been charged for what he did past, but he could be charged for refusal to obey a congressional subpoena. Right. So he had to provide the subpoenas. Otherwise, he would have been charged, convicted, and had to go to jail. So he provides them, and then he has basically a very big "so what." Okay, you got my diaries, so what? So they're kind of embarrassing, so what? You aren't going to be able to do anything about it. I'm not going to admit it. Now, this whole COVID fiasco and the fact that one person can begin dictating to the world what they should do, what they shouldn't do, what should stay open, what shouldn't, what your doctor is allowed to do, what he isn't allowed to do, that this one person, Fauci, he believes his brains are so much bigger than everybody else's that even another expert doctor, Dr. Mamoli, he can't possibly be right, which means your doctor that you go to see can't possibly be right. I mean, if he wants you to have ivermectin, hydroxychloroquine, well, that can't possibly be right. And why was that pressure put on of the push against drugs that had already been proven safe, like hydroxychloroquine, ivermectin? Well, because if they were, if they did help to alleviate symptoms, if they did help in prevention, then the emergency declaration that was needed to push through the new COVID drugs would not have been able to be there, because there would be no emergency, because there is something that is able to take care of it. And the other drugs that would be possible to be used off-label because they are for infectious diseases, et cetera. So we need to be able to do what we can do. We can't overcome the voice of the world. We can't overcome the entire media. We can't overcome the entire medical and scientific establishments all by our little lonesome. It's just impossible. So we do need to do what we can do. Get back as much control as possible. And that's one of the very important reasons why Share Healthcare exists. You mentioned I'm the general counsel for Share Healthcare. It's a 501c3, so it's a nonprofit, and it's a healthcare sharing ministry. Its function, its purpose is to help Christians share one another's medically necessary medical expenses. So how does this help us gain control back over our lives? Because we let you and your doctor have control. Your doctor is able to say what type of treatment he thinks you need and prescribe what type of medications he thinks you need. And you're able to choose your doctor. If the doctors in your state if the doctor establishment, the medical association in your state is making people lose their license if they would prescribe or do certain things, well, then you're able to go to another state. If the nation were to shut down, Share Healthcare has no network other than any licensed medical professional in the world. So you get to choose the doctor that's right for you, and your doctor gets to choose the care that's right for you. One of the other things we found out during COVID is things get expensive real fast. And because of COVID, if you look at the difference between the increase in the cost of medical care and the increase in the cost of insurance premiums have gone up much more than the actual cost of health care. It's just inflated. Why? Because everybody feels that they absolutely have to have it. Plus, they've gotten many more subsidies from the federal government because of it. And then that inflates things, and it just winds up being a real circular type of I don't want to call it a roller coaster because we don't have the dips down, but it just keeps chasing itself. Inflation perpetuates inflation and these type of things. And the insurance companies have been able to raise their premiums much more than actual inflation cost of healthcare. Well, Share Healthcare has not increased its monthly amounts in 7 years. Where 149 is the primary plan that everybody chooses, 149 for a single, 249 for a couple, and 349 for a family of four. And that's versus $2,684, which is the average for a family of four across the nation. And I really believe it's because of the fact of choice. Mm-hmm. You know, we're not dictating to people. They have a choice. They also have a choice of they don't feel like, well, I'm paying this outrageous premium, so I better go to the doctor every time I have a sniffle. Right. Well, you know, our members just don't do that. So we as we're as an entity, a nonprofit, a ministry, we need to remain humble and teachable and be able to adjust when we need to try to, serve our members that much better. Our members need to be teachable when they're hearing something that's going to help you have, more preventive care or have better longevity or that has a better health effect, or when you learn that there's something out there that's going to harm you that you hadn't known before. Well, we need to be teachable and avoid the bad things and go for the good things. Those are the lessons that I would want people to pull out of this Dr. Fauci faux pas, the disaster that's there. Rather than just feel bitter about what he did or what government did. Bitterness doesn't produce anything but bitter fruit. Mm-hmm. And what we want people to have is productive fruit, something that is helpful to them and helpful to those around them.
Yes, and thankfully our founding fathers realized that one of the best ways to produce good fruit is to give people the freedom to do it.
Absolutely. If we actually followed the Constitution and followed the type of guidelines they would want, none of this would have occurred because the government would not be having these huge medical institutions that somehow are the purview of the government. They just wouldn't. It wouldn't have been viewed as an appropriate function of the federal government.
And not just looking back, because there'll probably be another pandemic at some point in the future. Would it be good enough for your government to say, do this, not by law, but by advice, do this, don't do that, do this, don't do that, and you're free to do it or not?
Well, that's what George Washington did with smallpox, and that's what John and Abigail Adams did with their family in smallpox.
And then then it's in the hands of the people. For example, you don't close all the churches, but the government could say, hey, if you're breathing in everybody's face at church and one of you has it, you're going to pass it. But go to church if you want. And then people can decide. They're free.
The famous correspondence between John and Abigail around the signing of the Declaration, where John Adams had written to Abigail on July 3rd, saying about the vote that they'd done on July 2nd, declaring independence. And he was saying it ought to be a day that lives on in history. And then he goes on waxing eloquent about it. We ought to have illuminations and devotions, etc. And there's a delay. Abigail doesn't write back for a couple of weeks. And then she writes back and lets him know why she hadn't written back. Because she and the children were traveling to go get smallpox vaccinations. Huh. And that was very experimental at the time. Yeah. And it was difficult and, had to actually make an incision into the skin, put a little bit of pus from a smallpox infected person in there. It was difficult, but it helped the people not die like so many others were around. Right. And we don't think of what was going on in those other eras. And she was trying to talk to friends about doing it. And she mentions in her letter that somebody did. And she said, but, that's the price of pride. And we do want to be paying attention to good advice, but we want to be able to have free speech. And remember, that was one of the big issues during COVID, is that the people who did not agree with Dr. Fauci's viewpoint on what caused it or what the cure was, they were flat shut down, and a number of doctors actually did lose their medical license because they would treat people other than what the protocol was. And I don't know if I had mentioned it about the Dr. Mamoli, but Dr. Fauci said, well, since he's a federal worker and he's not willing to take the vaccine, he's going to lose his job. Well, that was a threat over a whole lot of people. And I don't know if you're seeing as many as we do up here, but many of the people that did take the vaccine are very much regretting it. They didn't want to do it in the first place. There's so many federal workers, so many military who had to, and now they're having the consequence. As Dr. Fauci did. 5 months after he had the vaccine, he had a lung infarction. Part of his lung died, which is one of the known consequences now from having taken that particular vaccine that he did.
And which vaccine was that?
Oh, you would ask me that. I think it was that Emirasamor. Well, what I would suggest to your listeners is Google it, and I'm sure you're going to find it.
Yeah.
I could never pronounce it even when it was right there in front of me, and I don't have the name right in front of me at this time.
Okay. Did you ever read
to which he also pled the fifth?
Oh,
he was asked about that, and didn't you have this lung infarction? And it was right after you took it. Well, I plead the fifth.
Yeah, just no. As the Bill Cosby cartoon said when I was a kid, no class, man. That's Mike Sharman with Share Healthcare. Again, find more information about Share Healthcare at their website, sharehealthcare.com, or you can call them at 1-844-SHARE-HC. If you would like more freedom when it comes to getting your medical bills paid and grouping together to do that, find all the information at sharehealthcare.com. And for Wave 94, I'm Doug Apple.